Hello, so we are live. أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم. خدا تعالى हमारा आका हमारा मौला तबीब रूहानी सैयदना मौलाना अली कदर मुफद्दल सैफुद्दीन ने क़यामत दिन तक बाकी ने बाकी रखियो आमीन. Hello, so we are live. أعوذ بالله السميع العليم من الشيطان. This is part of the SBMAA webinar series. We have had a lot of exciting webinars in the past. This is something that we've started this year to really showcase and highlight the amazing talent we have amongst Mumineen medical providers and healthcare professionals. So today we have Dr. Huzefa Bai Master, pharmacist from Chicago. Huzefa Bai, would you like to introduce yourself?
Sure. أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم. Thank you for this opportunity to discuss vaccines and kind of provide an update. I am currently the director of pharmacy for Meridian of Illinois. We are a managed care organization. The parent company is called Centene. So in my daily roles, I'm responsible for, as I like to say, anything and everything related to pharmacy, all the way from why a particular patient cannot get their medications up to and including formally a review of medications and creation of clinical criteria. In the past, I have been an associate professor of pharmacy where I had taught numerous therapeutic areas, including hypertension, some GI disorders, et cetera, et cetera. And so I'm really excited to present today on vaccines and provide an update. I will keep it brief because I do know this is a very busy time. And, I personally will not be offended if you're multitasking, let's say working on visas or something like that. And so I'm going to present up-to-date information as up-to-date as I could find regarding a couple of vaccines. Okay, so there are two vaccines I do want to focus on. So one is the RSV vaccine, and we'll spend a majority of our time talking about the RSV vaccines, the difference that's out there, ones that were approved, and really the goal here is to do try to do as much of a comparison as possible between the vaccines that are available. And then, the last few minutes we'll talk about just combination vaccines. And some that are up and coming, I would say, that haven't been approved yet. But again, you'll probably be hearing more about in the future. So specific for RSV vaccines, we'll go over the current vaccines. We'll talk about some of the adverse drug reactions that have been found after administration. I do also want to discuss RSV in pregnancy specifically, not RSV vaccine, but specifically the disease state. And then there is one new RSV vaccine that I do want to discuss as well. So we have a couple of different areas with RSV vaccines that we'll be talking about. So as I'm sure many of you do know or may have heard by now, there are 3 approved vaccines in adults. There is one in children, a quote unquote vaccine. It's a monoclonal antibody. But the 3 we'll be talking about are Abrysvo, Arexvy, and then Mresivia, which is the newest Moderna vaccine that was just approved. The Moderna vaccine was approved on May 31st. All right. You can see here are the indications. Abrysvo was approved in 60 years and older in pregnant persons, 32 to 36 weeks of gestation. Right? Arexvy is approved in 50 years and older. That is, again, a recent indication. Before it was approved for 60 and older, and then it did move, or the approval did go down to 50 years of age. And then Moderna, you can see 60 years and older as well. So we're expecting these RSV vaccines. If I'd given this talk last year, it would have been really new and exciting because it's just completely new field. We hadn't had these before. And so, after kind of a year of using the vaccines, administering the vaccines, there is some interesting data that we can present and discuss. So there was an MMWR report that was published, and this is kind of a quick overall comparison of Abrysvo versus Arexvy, looking at lower respiratory tract infection, RSV-associated lower respiratory tract infection, and lower respiratory tract disease. You can see here between Abrysvo and Arexvy, the vaccine efficacy is a little bit higher with the Pfizer product. You can also see in both LRTI and medically attended LRTI. Right. You can also note that because the Pfizer product is approved for pregnant individuals that are pregnant between 32 and 36 weeks, and there is the antibodies do cross the placenta, so you do have efficacy in the child. You can see the absolute risk reduction of infants 90 days after birth is 12.4%. So that gives you a number needed to treat of about 8, which is pretty significant in my opinion. So for every 1 pregnant female that you administer, I'm sorry, for every 8, you prevent 1 infection from RSV-related infection. So it's a pretty significant number. Okay. Abrysvo is a bivalent vaccine. Um, and Arexvy, just as a note, in the efficacy, it does drop in the second season to 62% for lower respiratory tract disease and 78.8% for severe lower respiratory tract disease. So we do see the second season efficacy does decrease slightly. So, I do want to ask a question out there for the audience, and just something for you guys to think about is, just think of the answer here. What percentage of adults over the age of 60 do you think received a vaccine last season? Yeah, just what do you guys think based off your experience, your history? What do you think it was? So we found the percentage to be about 22% of all adults over the age of 60 received the vaccine, which is a little higher than we'd anticipated. Originally, we had heard maybe about 10% of the people had received. So 22%, about a quarter, is pretty significant in terms of the uptake of the population. Right? And then the other question, just kind of, based off your experience, is what do you guys think is which is the market leader? Is it Arexvy or Abrysvo? So it's actually Arexvy, which is interesting based on some of the additional data I'm going to present. But yeah, we found about, um, from what I read, about 60% of the population had Arexvy, and the remainder had Abrysvo. So just a quick note about Arexvy. I did mention the age expansion of 59%. That was approved on June 7th, 2024. So just to note, it was approved. There was a phase 3 placebo-controlled randomized trial looking across a wide variety of countries and just different races as well. And they said that the participants 50 to 59, the data was comparable between the two groups. And it was a wide variety of patients. They had patients with chronic pulmonary disease, chronic cardiovascular disease, diabetes, chronic kidney disease, chronic liver disease, et cetera, et cetera. Just note that the CDC, though, and ASP have not yet to sign off on this recommendation. So this is new, pretty hot off the press, so to speak, for one of these talks. So moving forward, I did also want to mention the adverse drug reactions that we're seeing with the GSK product and the Pfizer product. So we'll go over a couple of tables. You can see here that the symptoms reported to be safe for a person greater than 60 who did receive an RSV by the manufacturer. And the thing to note here is that if you look at the percentages, right, if you compare GSK to Pfizer, you can see that in the GSK product, the Arexvy product, that they seem to be a little bit higher. If you look at symptoms related to vaccination, right, significantly higher. Injection site reactions, the local site reactions, almost twice as high. Or I'm sorry, more than twice as high for injection site reactions if you go through kind of the individual ones, pain, swelling, redness, et cetera, right? You can also see with systemic symptoms, right? It is about 1.5 times higher with the Glaxo product versus the Pfizer product. So, and the other thing is if you look at the health impact here, 6.2% versus 10.2%. So you do notice that it seems to really skew towards the GSK product in terms of the incidence of side effects reported by the manufacturer. Now, if you go to self-reported, some of the symptoms, you can kind of see, again, skewing quite a bit towards the Arexvy product, right? Where almost injection site reactions, so any local reactions twice as much. Systemic symptoms, again, about 1.5 times as much. And then fever, you can see a little less than half. So we're really gearing towards this Glasgow product. I do want to say one thing before I forget is that these are my opinions. They're not an opinion of SBMAA or the organization that I work for. So I do want to make sure just a disclaimer as well. Nor do I work for Pfizer or have any sort of financial incentive to any one of these products. This is what the data shows. And then finally, the third product here, the third one. Um, you can again see this is the person's age greater than 60 after receipt of the RSV vaccine. Just the number of events reported, again, really skews a lot towards the Glasgow product, either non-serious reports or even some among serious reports as well. So again, this is what we noticed in a recent MMWR report. Now, the one thing I did want to mention is that Guillain-Barré, which was an interesting thing that I picked up on. You can see here that both the products here, so the Pfizer product and the GSK product, again, the number of the incidence reporting 5 per million doses for the Pfizer product and GSK's 1.5 million is significantly high, right? When you compare it to the COVID-19 vaccine and looking at the reporting rate, which is much, much, much lower. So you can see again, it's something to note of when you're considering um, it, who to recommend a vaccine to or who can receive the vaccine. So shifting gears a little bit, moving from the side effects of the vaccine to really looking at pregnancy, because it is one product is indicated in pregnancy between 32 to 36, and coming from a managed care organization, we really try to push vaccines because we know the benefits of it. And so we're looking at, well, why does it matter, or what about does pregnancy really increase your risk of RSV infection? Well, so a meta-analysis was conducted, um, and you can see published earlier this year, and it looked at RSV-associated infections in pregnant women. Um, it kind of said, well, are there any sort of characteristics about it or anything that would lean towards a specific subgroup or what can we learn about RSV in pregnancy is really what the meta-analysis to try to do. We do know that the maternal RSV antibodies are transferred across the placenta to the fetus, and so then there is immunity to the infant, and that's where we get that absolute risk reduction that I showed earlier. So if you're looking kind of at the data here, right? Looking at some of the, looking at the data that's available in the meta-analysis that was done, there were 203 cases of RSV infection among 8,126 pregnant individuals that were tested. So the rates were really low, right? Especially, and the study was done in South Africa. And then in unpublished study in Thailand, they found that 10.7% there was an infection of about 10.7%. So it ranges from like 1% to 10%. So it's a wide range, right? But what they found was that the pooled proportion of RSV positivity is running about 3.4, 3.5%, with that 95 confidence interval being pretty large. Also note that the RSV-related hospitalizations was uncommon, right? But again, you're thinking about 3.4%. Is that significant or not? We'll get into that a little bit more. The incidence rate of RSV infection, again with the meta-analysis, was about 1.7 per 1,000 person months in seasonal studies, and about 4.9 per 1,000 person month in year-round studies. So that's a significant difference. So we find that the incidence rate is varied depending on the season. And we did talk about the hospitalization in pregnancy. That range is about 2.4 to 3 1,000 person years, which is much higher than the 50 to 64%, the 50 to 64 year age group, in both high and low and middle income countries. Right, which that rate is much lower. It's like 0.2 to 0.3 per 1,000 person year. So pregnancy seems to gear towards at least hospitalization in pregnancy seems to be a little bit higher RSV related. And then finally, when you're looking at when you're looking at some of the other data that's here, you can see positive pregnant individuals, 7 infants had low birth weight and 12 had preterm births. Again, these are really low. The numbers are really low. It's really hard to kind of gather some data. But I think in conclusion, you can say it's really hard to say it's studied. It's really hard to kind of put some of this together because the numbers were really low. But I think the overall conclusion is that there is a low incidence of RSV in pregnancy, but there's an increased risk of hospitalization. So part of the reason I'm presenting this information is just to show that, yeah, if you do have a pregnant patient that is there, we should really try to be encouraging the vaccine as much as possible. So finally, I do want to talk about the newest vaccine, the Moderna vaccine that was just approved. There was a placebo-controlled phase 2 to 3 trial that had over 35,000 participants in a mean follow-up of 112 days, and just looked at the data behind how effective is the vaccine. So when you look at the total incidence, right, of RSV-associated lower respiratory tract disease and RSV-associated acute respiratory disease, right? You can see the total incidence here. Here's the group, the active group, and here's the placebo-controlled group. So you can obviously it's significantly less in the active group, along with RSV-associated lower respiratory tract disease with 3 signs or symptoms, and respiratory disease as well. So a pretty significant difference between the 3 of them. If you look at the incidence of per 1,000 person years, the placebo group at 8.8 versus 1.4 in the vaccine group. Similar with placebo group of 3 or more signs and symptoms, 2.7 versus 2.5, and then a threefold difference between acute respiratory disease. Now, and you can kind of see here that the lower incidence, the injection site pain, some of the adverse reactions were very low. Grade 4 fever is reported in 0.2% of the participants. So again, very, very low incidence here. And then finally, in terms of vaccine efficacy, you can kind of see the data here, that a single dose of the mRNA vaccine, no safety concerns, and led to a lower incidence of RSV-associated lower respiratory tract disease and of RSV-associated acute respiratory disease than placebo among adults greater than 60 years of age. So we do find that the vaccine was effective. So when I'm comparing the 3, what I do like to do kind of here is kind of as much as an apples and apples comparison as I can do. I want to show this data to show, what is the vaccine efficacy, right? So you can see I did have to break it up because the data presented for the UXV was a little bit different. It wasn't as much as an apples to apples I could do. But you can see here that lower respiratory tract disease, 2 or more symptoms is higher in the Moderna product, and in the 3 or more symptoms, you kind of see it's higher in the Pfizer product. Safety wise, you can see that the local ADR is it was higher in the Moderna product, so versus the Pfizer product. Right. And then you can see here as well the efficacy for acute respiratory infection and respiratory tract disease. You can kind of see the difference. The numbers are here for you, vaccine efficacy and the side effects as well. So, just as much as an apples to apples comparison as I could do here to kind of give you the efficacy standards and the safety standards as well, or the percentages that were published in the trial. I do want to note that these numbers might look different than early in the presentation. I pulled the actual New England Journal articles and presented that for you when the articles that were used for approval. So they might be different than earlier, but again, this is kind of what was originally presented to get FDA approval. I thought that, when you're using the Moderna study that just came out with the efficacy data, I tried using that to kind of give as much of an apples to apples comparison, like I said earlier, as possible. Right. So I do want you guys take a moment here and just think, so what is one thing that you've learned about the RSV vaccine today? Just any of the RSV vaccines, anything, just take a moment, just review it. Okay. All right. And so one thing I do want to mention is that there is a COVID and flu vaccine combination that is now in phase 3 trials. They did find in phase 1 and 2 trials that it's similar immune response levels as the individual vaccine. So they've combined it together, and it's being studied in patients 18 to 64. Okay, it is an mRNA COVID vaccine designed to protect against both influenza and COVID-19 vaccine. The combination vaccine is generally similar immune response as those triggered by individual vaccines. And so the company is should be starting or is probably may consider starting the phase 3 trial in the coming months. Something to note. Kind of what I've heard about this is that they're looking at whether it be a yearly vaccine or every other year vaccine. How can they make sure that it's protected against both COVID and flu? So there will be some details working out. Additional data I'm sure will obviously be published once it's available. And then, you know, again, for some ASP guidelines in terms of spacing live and tenured vaccines, just want to put it in there because, co-administering vaccines with COVID-19 is a benefit. And so it's important to make sure that we're trying to get as many, I would say get, but we're administering as many vaccines as possible in one sitting. It just makes it much easier, easier for the patient, easy for the healthcare professional as well who's administering the vaccine. So I do want to take a moment and just think about what is your experience with vaccine coverage? And then do you think are some strategies to increase administration or increase uptake of vaccines, not only in our community, but also in the general health population as well?
So, Josefa, if I may add here, I know several Jamaats have had a lot of success holding vaccine drives, on uh, an Urus time or some time where there's already a lot of people at Masjid. I think you guys in Chicago have done something similar previously. You want to tell us a little bit about that?
Oh, sure. That's a great suggestion. So, what we've done traditionally, we started this probably God, I'm aging myself here, probably 15 to 17 years ago, where we would have an annual flu drive. And we were able to secure flu vaccines. And we would have, back when I started, it was, Ramzan was or Sherullah, sorry, Sherullah and Awakate, the flu season was beginning. And so on a weekend, we just have a flu shot, a flu clinic, literally a flu clinic. People would sign up, we'd find a room in the masjid, and then we'd just administer vaccines. We were giving somewhere up to 200 vaccines during an event. Yeah, and so we've continued that tradition since then. And so it's actually been very beneficial. I think the community really appreciates it. We've had to modify kind of where we get the vaccines from. It used to be from a hospital stock. Then we were able to find we had some Muminin and Muminat that work in retail pharmacies. We were able to provide the vaccines. And then we've shifted now. We are in contact with in the pharmacy, a person that owns his own pharmacies. He's a non-Mumin but Muslim, and so he does help us out quite a bit. We were able to administer last year. We were able to administer influenza vaccines, RSV vaccine, and also the COVID vaccine. So again, a wide variety. It just depends on the where you can kind of obtain the vaccine. So we do that, and we're going to continue it this year as well.
Wow, I think that really highlights, where pharmacists stand in terms of being that critical link between the general community and other healthcare providers and making these kinds of things happen.
Absolutely, absolutely, and especially as after the COVID epidemic, pharmacists have been a lot more autonomy to administer vaccines, and I think there's been a larger push just in the public, and so yeah, we enjoy doing it on our end. Like as a professional, I say that pharmacists really enjoy administering vaccines, especially if we can provide in our community. And I do want to make a note about the vaccine coverage. So obviously the Inflation Reduction Act did mandate any ACIP recommended vaccine has to be covered. And so I can tell you from our perspective as a managed care organization, we have a huge fluvention campaign nationally to try to push the flu vaccine. But locally as well, we do have an RSV campaign as well where we outreach our patients that are at high risk and really try to work with them to get the vaccine. Not only the adults greater than 60, but also the infants and the children, that the new RSV vaccine that came out for them, I'll call it a vaccine. We also try to work with parents to make sure that they're receiving the vaccine, make sure providers, the doctor's office, pediatricians have the vaccine and they can administer it as well. So again, we work on a number of different fronts to try to communicate both with patients and providers to make sure that they're able to administer the vaccine. So, that is the end of the presentation. I appreciate again, the opportunity. And if there are any questions, please don't hesitate to reach out to me or anybody in SBMA, and I'll be sure to answer them for you. So again, shukriya for the opportunity. आखिर में खुदा ताला मौलाना मुशफ़ दास and दास करे. Ameen.
I mean, thank you, Zobai, so much for giving your time and expertise into this presentation. It really, really was really succinct. You managed to take a lot of heavy data and kind of put it into words that other healthcare providers, outside of pharmacists can understand. And I think that's really useful. How many times do we get asked by other Mumineen or other our patients, about different vaccines and stuff? And honestly, a lot of times we don't have any idea, and we just refer them to our pharmacist colleagues. But having information like this is very valuable.
Thank you for the opportunity.
Thank you. If anyone has any further questions, please write it in on the chat. We'll be around for a few more minutes. And again, thank you so much to Zefabai and all those who stayed with us. This entire lecture will be on our YouTube page, available for all those who need it and are interested. Shukran.
Shukran.